Hello and welcome back to Mirror's Signal podcast. This mini-series is brought to you by Talking Send with Dr. Julia Malkin MBE, which is a Patreon page where members get access to a large number of videos to help you understand your neurodiverse learners on driving lessons. This mini-series is 10 episodes with Julia, going through 10 tips for teaching neurodiverse learners. I hope you enjoy these episodes. Julia, thank you very much for joining me again this evening. How are you?
Fine, thanks, no problem. I'm okay. Well done for
Good.
passing your standards check. Great A on that standards check. Well done, well done.
Thank you very much. There's definitely a factor in our conversations and the work that we do that helps me understand my pupils, whether they're neurodiverse or neurotypical or whatever language we're going to use. The work you do helping people understand the brain of their pupils is very much needed in this line of work. So thank you as well.
Thanks very much.
So we are back. This isn't about me and my standards check. This is 10 tips to help neurodiverse learners. And we are this week on tip number 5. So, what is tip number 5 for us?
Well, every driving instructor's got to have patience. That's obvious. It's all part of the personality needed for the job. But here we're talking extreme patience, and we're talking extremities of it. When you're dealing with something like sort of level 2 or 3 autism spectrum that you're teaching, you got to be prepared for time for them to answer questions and be able to recall information. If you ask a question, there could be a time delay with reciprocal communication. Sometimes it can be almost looking like heads in outer space, and maybe they've never actually heard you, but they have. It's just that, and you got to give them time. You got to give them time. You're patient enough not to butt in. You just got to think, I've got to wait until my person says ready. That kind of thing is just so important. Other types of patients include when people compare. I've had this quite a lot. When instructors think this pupil's had 30 lessons, they've got to be at this particular point by now, and they're not. And they've got to get used to the patience needed for the difference in learning to be able to know. So that sometimes it will take far longer for us to reach a certain milestone point rather than be able to drive it or learn at the same speed as everybody else. If we'll not do that, we can have some of us have fits and starts. We take one subject very, very well. Others, it can take ages and ages to master something. There could be a difficult task, a hard routine. It could be a imbalancing, especially if you're doing reversing exercises. There's a lot of different concepts involved in the driving task that will take a lot of energy and effort out of us. So another way in which patients can practice is more regular breaks than the everyday pupil. Some of us will need to collect our thoughts more. Some of us need to collect our energy more. Some of us will suffer with a bit of upset and will need a good old stress ball to do a bit of squeezing. Some might even like to get out of the car and have a walk because there's the amount of pressure and stress on us is far greater than it is with the everyday person. And so you need patience for us to have our brains reset to be able to concentrate on what you're doing. Other types of patience include being able to calm us down after being through a hazard. You can't immediately talk about fault or talk about a hazard because our brain's not ready. And you got to give a lot of patience to think, how's this brain going to reset itself? So you can talk about things a person likes to do. You can talk about the favourite hobby, interest, the dog, anything like that that helps calm a person's brain. And then they'll be in a more receptive state to be able to fix the fault on the road or be able to talk about a hazard. And it takes patience for an instructor to do that. So sometimes you're having to break boundaries. You're having to push back much more. You're really pushing hard. You got to be prepared to think outside that box and think. It's more of a holistic, you're not dealing with the driver, you're dealing with the person. It's almost as if you got to have the patience to understand the brain and how it works. You got to understand the amount of energy that it takes for the person to be able to do a task. The emotional response a person could have to not be able to do that task as well as the parent. So you need to push the levels of patience far beyond that of ordinary driving instruction to be able to teach one of us. It is very extreme what you're going to need. You will need some extreme patience. Extreme patience, that's what you're going to need.
I definitely understand that. As I've mentioned to yourself, Julia, my diary is becoming more and more neurodiverse learners. And I expect one of those reasons is I think I am quite patient. But something I would like to ask on that, as driving instructors, we often do have this timeline in mind that on average from the DVSA, we're looking at 45 hours with a driving instructor. Now, I understand some of the concerns if we've got a student at, say, 35 hours and they're not getting something. Can I ask you about the pupil? Would a pupil who's diagnosed with any of this, would they come expecting a longer process? So they maybe expect it's going to take longer than average, and we're putting pressure on ourselves. But would a pupil be expecting the process to take longer?
All right, so got about 25 variables in that.
Okay.
Depends if they pushing or pressure out of the family, depends if an older brother who could drive before, depends on peer pressure from the mates if they've got any friends. There's things like the kind of car you've got, how easy it is to drive, the kind of area that you're in, the kind of time of day they're running a lesson. There's 1,000 different things. If they're in that diagnosis room and they've had a diagnosis and somebody's told them it will take longer to do this task, that task, and that task, then they'll automatically expect it. There's things like that. There's things that diagnosis report tells them. There's things that the parents are telling them. They get knowledge from no end of factors. There's no end of factors. I anticipate longer with them, especially if the autism is level 2 or 3 rather than 1. There's are 3 levels of autism. I expect more of a delay with conditions like dyspraxia, because that affects a lot of psychomotor and the senses and concept of where the car physically is and where drivers in relation to the vehicle. Watch for memory trouble. If there are any conditions that affect memory, dyslexia does, dyspraxia does, ADHD can do. That kind of problem, well, they'll take longer. ADHD can be quite severe, especially when they're getting distracted and bringing back to a task and they forget where they're going. If they do that very often, then it will take longer for them to do a task. Of course it will. And then there's the ADHDs who like the task to be put on a smaller, shorter kind of level. If they do one little left turn and a full talk through, that's completing one task. And if they do it again under a prompted level, that is to them another task. So you're breaking it down further, so that will take longer as well. But bear in mind that not everybody will take longer. Don't treat it as a standard thing. The biggest thing about that is the fact they should never consider us to be slow learners, right? It took me about a year to learn to drive, yet my IQ is 152 in Mensa, right? Would you say it was slow? No. Would you say it was a slow learner? You better not. But it took me a year, see? It's the complexity of the skill and the social imagination involved and the psychomotor, remember the highway code and watch for the houses. It's a big, big thing. It's a massive, massive task. And also, You've got to remember that I taught somebody on the autism spectrum. He had no instructor prior to me, no car to practice in. 8 lessons with me, 8 1-hour sessions. He was test down. 8 hours. He didn't even come from my town. He got a train every week to come to me. And after 8 hours, I found it was test done, and that was it. And then I transferred him to an instructor in his hometown that had taught it. He was given just a couple of, say, about an hour or so of learning those roads, learn the route, learn where the test centre is in his hometown. There's a bit of time going around there, and he passes his test first time with no faults. So you can't just say we're slow. They expect us to do more because in 9 hours he was able to pass his driving test. So that a lot of it again is the instructor. That's another factor with all this. If an instructor knows the neurodivergent condition of the person, is able to engage that person's brain and know the way that it learns, they engage information in a way that person learns and records it into the brain, and is equivalent of a record and play situation. You're almost dealing with a computer. You're dealing with a machine. And a lot of people on the spectrum, it's almost like programming a machine. And if you know exactly how the machine's set up and the way it works and what to do and when to do it, you'll find the learning speed will skyrocket. I had one person for 1 hour, very first driving lesson once, and I had his dad in the back of the car, and his dad couldn't believe it. Because all of a sudden, in 1 hour, we'd done the controls move off, stopping, approaching, emerging, and we were doing emergency stops all that time. The lesson was up. So, all depends on the instructor as well. Does the instructor understand the condition? Can they, really get a good bond going with that brain? What about a level of trust? Sometimes it takes weeks to build up trust between instructor and pupil. That'll slow them down as well. There's so many different factors when you're dealing with how long it's going to take. But if somebody says to me, neurodivergent conditions, ADHD, autism, etc., I'm prepared for a longer trip, I'm prepared for more hours, I'm prepared for a bit more stress, but it isn't necessarily like it. Because you can find those that just about break every social stereotype in the book when it comes to this. It's very stereotypical to think of us as slow learners. I'm slow socially, but not slow mentally. Mensa will tell you that. So every person's different. We've all got positives, we've all got negatives. Find out what those positives are with that brain. Go with the brain and what it tells you. Learn that brain. And then you'll find that the more you know about it, then the less hours it's going to be. And that works for the vast majority of ADHD, 90% of autism level 1s, and a couple level 2s and 3s as well. Yeah.
I think that's an excellent tip. And I think it applies everywhere,
Yeah.
especially when you get learners. And I've had 3 different driving instructors, and I don't understand roundabouts, and they were shouting at me. And it's like, okay. And at that point, it doesn't matter who that pupil is. They need patience, they need calmness in the car, and they need someone to work with them. So I really like that one. And I think for driving instructors, that should be applicable everywhere. But what a great tip for how we can help our learners. Thank you very much, Julia.
Thanks very much.
So, thank you for listening or watching that episode. If you would like more information from Julia, or you would like to learn more about teaching neurodiverse learners, you can find all the information in the description, or you can sign up to the Patreon membership. Just search for Talking Send with Dr. Julia Malkin MBE. Thank you.